Cardiologist warns, if your nails look like this after 60, your heart may be in danger. Before you embark on any other activity, I want you to perform a very simple yet profoundly important action. Please, at this very moment, hold up one of your hands and direct your full, unwavering attention towards it. This isn't just about a fleeting glance or a quick look, it's about a real, deliberate, and truly careful observation. Because within the next few crucial minutes, I am going to unveil a profound piece of information that the vast majority of people over the age of 60 have, regrettably, never been made aware of. This is something that expert cardiologists encounter and observe every single day as part of their routine clinical practice, a fundamental insight that they, due to various constraints, rarely have the dedicated time to thoroughly explain to their patients. In an astonishing way, your very own fingernails have been silently and continuously recording the vital activities of your heart and the extensive network of your blood vessels. They have been diligently performing this intricate recording function throughout the entirety of your life. And if you are equipped with the precise knowledge of exactly what subtle indicators to search for, these unassuming nails possess the incredible potential to issue an early warning, alerting you to a developing cardiovascular crisis long before it ever manifests into a life-threatening event. I am Dr. Sam, and I have dedicated many years of my professional life to working closely with adults age 60 and above, focusing intensely on preventative cardiovascular care. Throughout my extensive experience, there is one particular recurring observation that genuinely troubles and concerns me deeply. Time and again, patients present themselves in my clinic after suffering a heart attack or a stroke, and when I conduct a meticulous examination of their physical state, particularly their hands, the critical warning signs were already clearly etched upon their nails. Sometimes these signs were present months before the severe cardiac event, occasionally even years in advance. Tragically, nobody had noticed them, and crucially, nobody had informed these individuals what specific signs to actively look for. Before we delve any deeper into these life-saving insights, if you find this kind of detailed, health-empowering information to be valuable and useful to your well-being, I urge you to please hit that like button right now. It is a quick action that takes less than 1 second of your time, and it genuinely makes a significant difference, helping this vital message reach countless other people who desperately need to hear it. Furthermore, I invite you to share your age in the comments section below, and alongside that, please indicate whether anyone in your immediate or extended family has ever experienced a heart attack or a stroke. I personally read every single comment, as your invaluable answers help shape and inform the specific topics I choose to cover in my subsequent educational content. This unfortunate information gap ends today. Please remain with me until the very end of this presentation, because the final sign I will discuss is often the one that consistently astonishes and shocks people the most. So, why exactly do your nails possess and carry this wealth of critical information? Your nails originate and grow from a specialized structure known as the nail matrix, which is strategically positioned just beneath the very base of each nail. The rapidly dividing cells within this matrix are in direct and constant contact with your bloodstream, receiving their essential nourishment from the tiniest blood vessels in your entire body, the intricate network of capillaries that run directly beneath your nail bed. Because these microscopic vessels are so extraordinarily fine and delicate, they are in fact among the very first physiological structures to visibly display signs of stress or dysfunction when your broader cardiovascular system begins to experience difficulties or struggle. Consider your nails, therefore, as a kind of dynamic, live monitor that your body has been silently and continuously operating every single day of your life. After the age of 60, this internal monitoring system becomes even more critically important. In your 30s and 40s, your robust heart can often quietly compensate for early stages of dysfunction for many years without anything visibly apparent appearing on your nails. However, after the age of 60, those compensatory reserves become significantly thinner and less effective. Consequently, crucial warning signals begin to surface much earlier, and your nails are frequently the initial location where these vital indicators first make their appearance. A typical 15-minute medical appointment simply cannot realistically cover every single aspect of your health, and a thorough nail examination rarely makes it onto the priority list of clinical checks unless something is already dramatically and unequivocally obvious. The extensive medical research supporting these observations exists abundantly in scientific literature. It just unfortunately never manages to reach the individual sitting at home who genuinely needs this empowering knowledge. That critical information gap is precisely what I am here to bridge and close for you. Sign 1. Terry's nails. The very first significant sign we will examine is known as Terry's nails. This is not a medical term that most ordinary people would have encountered in their daily lives, but once you acquire this vital knowledge, you will find yourself looking at every pair of hands with a completely new and informed perspective. Terry's nails manifest when the entire surface of the nail takes on a distinctly opaque, whitish, or a very pale, almost bleached appearance, somewhat resembling frosted glass. This distinctive paleness is accompanied by one defining and crucial feature located at the very tip of the nail, a narrow, distinct strip of pink or reddish color situated at the far edge of the nail, typically only a few millimeters in width. That specific, vibrant strip at the very tip is the singular characteristic that unequivocally differentiates Terry's nails from simply ordinary pale nails. Therefore, it is essential to actively and specifically look for this subtle yet critical detail. Extensive research, specifically studies published in reputable journals such as Cardiovascular Medicine, has unequivocally identified Terry's nails as being significantly and strongly associated with the presence of coronary artery disease, congestive heart failure, and diabetes. One particular study even revealed that individuals exhibiting Terry's nails had an odds ratio of over 6 for developing coronary artery disease compared to those who did not display this nail pattern. This is by no means a minor statistical footnote. It represents a major and undeniable signal of underlying health issues. Furthermore, every single condition that has been linked to Terry's nails shares one fundamental characteristic. It develops slowly, insidiously, and often, silently, over many years before any dramatic or acute symptoms finally manifest. I recall a patient, whom I'll refer to as Robert, who came to see me at the age of 71. He had no dramatic complaints and genuinely felt reasonably well overall, though he did mention feeling more fatigued than usual, something he quite naturally attributed to the process of aging. During my meticulous examination, my attention was drawn to his nails, which were unusually pale and exhibited that characteristic reddish strip at the very tip. I proceeded to ask him a series of careful, probing questions and subsequently ordered an echocardiogram. The results of this diagnostic test revealed early-stage heart failure, a condition that had been silently developing for close to 2 years without presenting any overt or obvious symptoms. Today, Robert is doing exceptionally well. He received the correct treatment at precisely the right time, and it was the subtle, overlooked signs on his nails that initially opened the crucial conversation which ultimately made that successful intervention possible. Sign 2, Lindsay's nails. The second significant sign we need to discuss is known as Lindsay's nails, sometimes more descriptively referred to as half and half nails. The appearance of these nails is so distinctive and visually striking that you will almost certainly recognize them immediately once you are fully aware of what specific features to look for. In this condition, the nail is clearly and visibly divided into 2 distinct zones. The half of the nail located closest to your cuticle is white or very pale, often almost translucent. In stark contrast, the half of the nail closest to the tip displays a brownish-red color. The dividing line between these two clearly demarcated zones is typically sharp, crisp, and unambiguous. Clinical research has associated Lindsay's nails with both heart failure and liver cirrhosis, indicating serious underlying conditions. These distinctive nail changes tend to appear after the body has been subjected to sustained circulatory stress for an extended and significant period of time. Both Terry's nails and Lindsay's nails represent disorders primarily affecting the nail bed color rather than the nail plate itself. And importantly, both conditions serve as a visible reflection of how effectively blood is reaching and nourishing the smallest, most delicate tissues in your body. When the circulation to the fingertips is compromised or impaired over a sustained period, the delicate nail bed gradually loses its normal, healthy pink color and instead begins displaying these altered, often striking patterns. Crucially, both of these signs are readily visible in ordinary daylight, requiring absolutely no specialized equipment. Take a moment right now to hold your hand under good, natural light and carefully scrutinize each nail. You can easily check for both of these critical signs in under 30 seconds. I encourage you to do this now while the detailed descriptions are still fresh in your mind. Sign 3, Muirche's lines. The third critical sign we will cover is called Muirche's lines. These manifest as multiple horizontal white lines that traverse the nail plate, running parallel to the lunula. The lunula, for those unfamiliar, is that small, characteristic crescent-shaped pale area located at the very base of your nail. A key distinguishing feature of Muirche's lines is that they do not feel raised or textured when you gently run your finger across them. You can clearly see them with your eyes, but you absolutely cannot feel them to the touch. This particular detail is one of the most important aspects that differentiates them from other types of nail ridging or abnormalities. They are purely a visual signal, not a textural one. What makes Muirche's lines particularly significant and worthy of our attention is the robust scientific research supporting their clinical importance. A comprehensive study meticulously examining the intricate relationship between various nail findings and the presence of cardiovascular disease discovered that Muirche's lines were a statistically significant and powerful predictor of heart failure, exhibiting an odds ratio approaching 6. The fundamental underlying physiological reason for this is that these subtle lines are a visual reflection of low albumin levels in the blood, which is itself a crucial marker indicating that the body is under prolonged and significant nutritional and circulatory stress. When the heart is struggling to efficiently circulate blood throughout the body, the rest of the body inevitably begins to experience the far-reaching consequences of this circulatory strain. I had a patient, whom I'll call Catherine, who came to see me at the age of 68. She was quite active, maintained a healthy weight, and genuinely felt perfectly fine. During her routine visit, she mentioned almost as an afterthought that she had noticed some faint, horizontal lines on her nails over the past few months, but she had simply assumed it was probably nothing of concern. I examined her hands very carefully and immediately recognized the distinctive Muirche's lines stretching across several of her fingers. A subsequent cardiovascular workup revealed early heart failure, a condition that was, thankfully, entirely manageable at that specific stage. The lines had been quietly appearing for months, her body subtly asking for much-needed attention. Sign 4, Bow's lines. The fourth sign we will discuss tells a markedly different story from the others we have examined. Whereas most nail signs tend to build gradually, over time, and often reflect chronic, ongoing conditions, Bow's lines appear distinctly in response to a specific, significant physiological event. Bow's lines are characterized by deep, horizontal grooves or noticeable depressions that run across the nail plate. They manifest because when the body undergoes a significant physiological shock, such as a heart attack, cardiac surgery, a severe infection, or any other major health crisis, the nail matrix temporarily ceases its production of new nail tissue. When nail growth eventually resumes, this period of pause leaves behind a distinct groove. Over time, as the nail continues to grow, that groove gradually moves out towards the tip of the nail, and its precise position along the nail can actually help healthcare professionals estimate when the significant event originally occurred. What makes Beau's lines clinically important and incredibly valuable is their ability to reveal a past cardiac event that the patient themselves may have never recognized or attributed to their heart. Silent heart attacks, for instance, are far more common than most people realize, particularly among older adults, where the classic dramatic symptoms often associated with a heart attack are frequently absent. I had a patient, whom I'll refer to as Harold, who came in for something entirely unrelated to his heart. During the examination, I noticed a very clear and distinct horizontal groove etched across nearly all of his fingernails. I inquired about it, and after a moment of reflection, he recalled being seriously unwell about 4 months earlier with what he had assumed was an unusually severe flu. Subsequent testing revealed that he had, in fact, experienced a silent heart attack during that very illness. His Beau's lines clearly told the story that his subtle symptoms never had. Sign 5, splinter hemorrhages. Now, I want to redirect your careful attention to something you need to look for underneath the nail surface rather than on top of it. These distinctive markings are called splinter hemorrhages, and their appearance is precisely as their name suggests: tiny, dark splinters or very thin, dark lines that run vertically beneath the nail plate. These are essentially small collections of blood that have become trapped within the delicate capillaries of the nail bed. A single splinter hemorrhage occurring after minor physical trauma to the hand is typically nothing to be concerned about. However, the presence of multiple unexplained splinter hemorrhages across several fingers is an entirely different and far more serious matter. In medical training, the classical association for unexplained splinter hemorrhages appearing across multiple nails is infective endocarditis, which is a severe infection of the inner lining of the heart's chambers and valves. This dangerous condition develops when bacteria manage to enter the bloodstream and subsequently attach themselves to damaged heart tissue. The infection itself can cause tiny clots to break off and travel to distant blood vessels, including the minute and delicate ones found in your nail bed, where they become visible as splinter hemorrhages. Infective endocarditis is a very serious medical condition that absolutely requires urgent medical attention and prompt treatment. I recall a patient, whom I'll call Frances, who noticed these dark lines on several of her nails. She mentioned them to me almost as an afterthought during an appointment that was primarily focused on something entirely different. She was subsequently diagnosed with a heart valve infection that was thankfully caught in time to be treated effectively. She told me afterward that she had almost not mentioned it at all because she simply assumed it was nothing significant. Sign 6, lunula color changes. The small, whitish, crescent-shaped area located at the base of each of your nails is known as the lunula. Most people commonly perceive it as simply a cosmetic feature of the nail. However, it is, in fact, the visible portion of your nail matrix, the highly active zone where new nail cells are continuously being formed. And the precise color of your lunula is, remarkably, one of the most frequently overlooked yet diagnostically significant signals on the entire human body. Research has significantly associated a reddish lunula with both valvular heart disease and congestive heart failure. Conversely, a bluish or purplish lunula often suggests underlying problems with oxygen delivery within the circulation, a phenomenon similar to the cyanosis observed in more advanced stages of cardiovascular disease. Furthermore, a lunula that has faded to almost nothing or has become extremely pale is frequently a clear sign of anemia. Anemia, in turn, places direct and considerable strain on the cardiovascular system because an anemic heart must work significantly harder and pump more vigorously to compensate for the reduced oxygen-carrying capacity of the blood. All three of these distinct color changes in the lunula warrant prompt medical attention and thorough investigation. I remember a patient, whom I'll call Dorothy, who was 74 years old when her daughter, who happened to be a nurse by profession, noticed during a family visit that the characteristic half-moon shapes on Dorothy's nails had almost entirely disappeared. Dorothy herself had not noticed this gradual change because it had been happening so slowly and subtly over time. She had been looking at those very same nails every single day and had simply adjusted to the new normal without consciously registering that anything significant had shifted. Her astute daughter encouraged her to raise this observation at her next scheduled medical appointment. A complete blood count and a comprehensive cardiovascular workup subsequently revealed significant anemia and undeniable early cardiovascular strain. Both conditions were thankfully caught and treated effectively before anything truly serious had the chance to develop. The capillary refill test. Do this right now. I now want to empower you with a simple yet incredibly informative test that you can perform on yourself immediately, requiring nothing more than your own two hands. This vital self-assessment is called the capillary refill test, and it directly measures how quickly your smallest, most delicate blood vessels recover from localized pressure. Here is precisely how you perform it. Hold your hand comfortably at the level of your heart. Use the thumb of your opposite hand to press firmly and steadily on one of your fingernails for approximately 2 seconds. You will clearly observe the nail bed beneath the pressure going pale as the blood is temporarily pushed out. Then release the pressure and immediately begin counting quietly to yourself. In a healthy adult with robust circulation, the healthy pink color should return to the nail bed in under 2 seconds. If, however, it takes 3 seconds or longer for the color to return and you consistently get the same slow result when you test 3 or 4 different fingers, that is a meaningful and concerning indication that your microvascular circulation may be sluggish or compromised. Extensive research has linked persistent, slow capillary refill in older adults to reduced cardiac output, previously undiagnosed atrial fibrillation, and an elevated risk of stroke. I urge you to perform this simple yet critical test right now before you finish reading this information. Ensure you do it in a warm room with warm hands, as cold temperatures can distort the accuracy of the result. A patient I'll call William decided to try this test one evening. He counted nearly 5 full seconds before the healthy color returned to his index finger. He then proceeded to test his thumb, then his middle finger, and subsequently the fingers on his other hand. Each time, he observed the same consistently slow result. He promptly called my office the following morning and meticulously described exactly what he had observed. A full and comprehensive workup subsequently revealed previously undiagnosed atrial fibrillation, which is one of the most common and dangerous causes of stroke in adults over the age of 60. He was immediately placed on appropriate treatment, and based on everything that current cardiology literature tells us, that simple phone call very likely prevented a major, life-altering stroke within the following year. Remarkably, he had no other symptoms at the time, absolutely none. Your practical framework, starting today. Beginning today, I want you to make this a regular practice. Take both of your hands to a window where you can access good, natural daylight. Look at each of your nails, one at a time, and systematically work through the following comprehensive checklist. First, thoroughly check the overall color of your nail bed for any signs of blueness, purplish discoloration, or an unusual generalized pallor. Next, carefully inspect the very tip of each nail for that characteristic reddish band that signals the presence of Terry's nails. Then, look intently for the sharp, distinct two-tone division that is indicative of Lindsay's nails. Search for any horizontal white lines across the nail that you can clearly see but cannot feel to the touch. These are Muirca's lines. Check for any deep horizontal grooves or depressions, which are known as Bowes lines. Look meticulously for tiny dark lines or splinters located beneath the nail surface that appear without any history of trauma or injury to the hand. These are splinter hemorrhages. Examine the base of each nail for the lunula, paying close attention to its color and noticing whether it appears to be shrinking or receding. Finally, perform the capillary refill test on at least 3 different fingers and honestly count the seconds it takes for the color to return. Write down precisely what you find. This step is far more important than most people realize. These changes in your nails are often slow and gradual, and human memory is notoriously unreliable when trying to recall subtle shifts over periods of months. Take a high-quality photograph of your hands in natural light today. That image will provide you with something concrete, objective, and honest to compare against 6 months from now. If you observe just one of these specific signs, it is prudent to mention it at your next routine medical appointment. However, if you observe 2 or more signs together, do not wait for your annual checkup. Call your doctor's office this very week. Clearly describe what you have observed, and specifically ask whether you should be evaluated sooner rather than later. Before I conclude, if what you have read and learned today has provided you with valuable knowledge that you did not possess before, please consider subscribing to this channel. More importantly, I urge you to share this information with someone you genuinely care about, a parent, a sibling, a dear friend who has mentioned heart concerns, or someone you know is over 60 and may not be paying close enough attention to their health. You truly do not know whose life this vital information might profoundly change or even save. Share it now, do not postpone it for later. One final critical point, please do not use any of this information to attempt to diagnose yourself. What these signs do, fundamentally, is give you a specific, informed, and compelling reason to initiate a crucial conversation with your doctor. The full clinical picture, your detailed medical history, your current medications, your other existing symptoms, is what ultimately produces an accurate and reliable diagnosis. Your job is not to diagnose your condition. Your job is to notice these subtle changes, to document them diligently, and most importantly, to speak up and communicate them to a medical professional. That is the essential part that most people never do, and it is precisely that part that makes all the difference in securing your health and well-being. Your nails have been quietly sitting at the end of your fingers your entire life. They have been meticulously taking notes every single day about how your blood is moving, how your heart is working, and what your smallest blood vessels are doing. The only thing that was missing was someone telling you how to accurately read what they have been recording all along. You now have that knowledge. Use it wisely.